So good morning, I'm Kirsdayan Masiti from BS Ed Filipino. So today I will be discuss about advantages and disadvantages of family planning. So we all know that family planning allows both men and women to make informed choices on when and if they decide to have children. So there have a methods of contraceptions. First, long-acting reversible contraception such as the implant or intrauterine device. So, hormonal contraception such as birth control pill and the birth control injection. So, barrier methods such as condoms, emergency contraception, fertility awareness, and permanent contraception such as vasectomy and tubal ligation. So we have also the benefit of family planning, contraception according to the World Health Organization or WHO. First, prevent pregnancy-related health risks in women, reduce infant mortality, help prevent HIV and AIDS, empower people and enhance education, and reduce adolescents pregnancies. So, marami sa atin dito na maagang nabuntis or mga teenage pregnancy. No? And lastly, as slow population growth. So, araw-araw, nadadagdagan tayo. At araw-araw din, may namamatay. So, let's proceed the benefits of using family planning according to the DOH. So, family planning provides many benefits to the family. So, sa mother is, ang benefits niya is enable her to regain her health after delivery or after manganak. So, gives enough time and opportunity to love and provide attention to her husband or children. So, gives more time for her family and own personal advancement. So, when suffering from an illness, give enough time for treatment and recovery. So, sa children naman is healthy mothers produce healthy children. Pag healthy yung mother, healthy rin yung bata. So, children will get all the attention, security, love, and care they deserve. So, sa father is lighten the burden and responsibility in supporting his family. So, as we all know na ang mga fathers, sila yung nagpro-provide yung mga needs ng asawa or partner at ng mga bata. So, father also enables him to give his children their basic needs. So, next, let's proceed the advantages. So, what are the advantages of family planning? So, first, birth control health risk. So, some forms of birth control pose health concerns for women and men, such as allergies or spermicides or latex. Allergies to spermicides or latex. So, responsibility of pregnancy. Couples who are engaging in sexual activity should always consider the possibility of an unexpected pregnancy. Yung mga hindi sinasadya, no, na pagbubuntis or or aksidente lang. So, third is pregnancy after birth control. No, it is possible to get pregnant almost right away after stopping hormonal contraceptives such as birth control pill of after having the IUD removed. No, it might takes months for ovulation and the menstrual period to return to normal. So kapag hininto or in-stop natin yung mga contraception or contraceptives na ginamit natin, may possibility na mabubuntis talaga yung babae. So the natural family planning method. So is the method that uses the body's natural psychological changes and symptoms to identify the fertile and infertile phases of the menstrual cycle. It is also known as fertility-based awareness method. What are the difference about fertile and infertile? So, ang fertile is, ito yung parang malapot na maputi. At ang infertile naman, ito yung malinis pero malapot din siya, no? Pero tinaw lang siya pagka kung ano niya. Natural family planning methods are generally the preferred contraceptive methods for women who do not wish to use artificial methods of contraception for reasons of religion or who, due to rumors and myths, for other methods. So we have a type of natural family planning methods. First, we have periodic abstinence or fertility awareness methods. Second, use of breastfeeding or lactational laminoria method or LAM or LAM. Third is coitus interruptus or tinatawag natin na withdrawal or pulling out method. So, periodic abstinence or fertility awareness method. This natural family planning method involves refraining from sexual intercourse. This is the most effective natural birth control method. It is also the best way to avoid sexually transmitted infection or STD. There are people who find abstinence difficult to follow, hence may not prefer this method. So, maraming mga couples na hindi prefer na gumamit ng periodic abstinence or fertility awareness method. Kasi, marami siyang dapat gawin, no, para masunod yung tamang proseso o tamang paggamit, no. So, there are 3 common techniques used in periodic abstinence methods. First, rhythm or calendar method. So, second, basal body temperature or BBT monitoring. And cervical mucus or ovulation method. So, cervical mucus devised by John and Evelyn Billings in 1960s. So, what do we mean by lactational amenorrhea method? So, is the contemporary infertility that occurs in a woman when she is not menstruating after giving birth and that she is fully breastfeeding. So, if the mother is not fully breastfeeding, this method will not be effective. So, kailangan talaga is mag-breastfeeding tayo, no? The woman devised to use another birth control method if she wishes to avoid getting pregnant soon. Fourth, this method is also known as withdrawal or pulling out. During intercourse, the man's sperm is not injected inside the woman's reproductive system. So last, the advantages to this method is the instance of pre-ejaculation. The fluid that contains spermatozoa could still cause fertilization. So let's proceed the hormonal contraception, artificial family planning. So hormonal contraceptives are an effective family planning method. So ito din yung ginagamit ng mga babae kapag iniiwasan or ayaw nilang mabuntis, no? Oral contraceptives, it is known as pill, no? Oral contraceptives contains a synthetic estrogen and progesterone. Estrogen suppresses ovulation, while progesterone decreases the permeability of the cervical mucus to limit the sperm's access to the ova. So, transdermal contraceptive patch. It is medicated adhesive patch that lays on the skin to deliver a specific dose of medication through the skin and into the bloodstream. So, sa makikita nyo sa picture, at nilalagay lang siya sa upper outer arm, dito, nilalagay lang siya dito, at dito sa buttocks, at dito sa likod. Yan yung paggamit ng transdermal contraceptive patch. So next, the vaginal ring. It is a birth control ring inserted into the vagina and slowly release hormones through the vaginal wall into the bloodstream to prevent pregnancy. So, pinapasok siya sa ating vagina. And doon siya nakapwesto, no, sa makikita nyo sa picture, no, malapit siya. Siya yung pumoprotekta para hindi makapasok yung sperm ng lalaki sa uterus. So next, we have subdermal implants. So subdermal implants involve the delivery of a steroid progestin from polymer capsules or roots placed under the skin. So ito yung makikita natin sa lower arm natin na parang stick, no? Diyan siya nilalagay. So the implants or the hormone diffuses out slowly at this stable rate, providing contraceptive effectiveness for 1 to 5 years. So hormonal injections. It is contraceptive injection given once every 3 months. No? Kapag ka 3 months, mag-i-inject ka ulit, 3 months mag-i-inject ka ulit. So para ma-maintain yung pagpigil or prevent sa pagbubuntis, no? These are also thicken cervical mucus to keep the sperm from reaching the egg. So next, we have intrauterine device. T-shaped plastic device wrapped in copper or contains hormones. IUD prevent fertilization of the egg by damaging or killing the sperm. So siya yung pumapatay ng sperm, no? Or siya yung lumalaban sa sperm para hindi makapasok sa reproductive system ng babae. So, intrauterine device, it makes the mucus in the cervix thick and sticky, so sperm cannot get through to the uterus. So, makikita natin sa picture, letter T siya, no? And the chemical barriers, such as spermicides, vaginal gills, and creams, and glycerin films are also used to cause the death of sperm before they can enter the cervix. So, if ang uterine device is pumapatay ng sperm, also these chemical barriers, no? Sila din yung pumapatay ng sperm. But these chemical barriers cannot prevent sexually transmitted infection. So, hindi talaga siya safe para sa atin. Kasi, there's possibility na makakuha tayo ng sakit or mga disease. Like, the most common disease is HIVs and or AIDS. No? Very careful lang po talaga tayo kapag gumagamit tayo ng mga contraceptives. No? So, let's proceed the diaphragm. Dome-shaped barrier methods of contraception that blocks sperms from entering the uterus. It is filled with spermicide and fitted over the uterine cervix. So, ipapasok natin siya doon sa, kumbaga, siya yung, ang tawag dito, siya yung, iyahang ang uterus ba, ginaprotektahan para dili makasulod ang sperm, no? So, cervical cap. It is a silicone cup inserted in the vagina to cover the cervix and keep sperm out the uterus. Spermicide is added to the cervical cup to kill any sperms that may get inside the protective barrier. So makikita natin sa picture, no? Yung cervical cup. Parang naiipon yung sperm inside diaphragm, no? Then hindi siya makakapasok, no, sa reproductive system ng babae. Parang nakukulong lang yung yung sperm sa loob. So, next is female condoms. It is a latex or synthetic rubber sheet placed on the erect penis before vaginal penetration to trap the sperm during ejaculation. So, ito yung common na ginagamit ng mga lalaki the way mag-intercourse sila. No? So, condoms can prevent STDs. Or, ito yung, there's possibility din na hindi tayo makakakuha ng infection dito. But, hindi lang po tayo masyadong makampante dahil hindi po 100% is safety po ang paggamit ng condoms. So, female condoms, it is a thin pouch inserted into the vagina before sex, serving as protective barrier to prevent pregnancy and protection from sexual transmitted diseases. So, the difference between male condoms and female condoms. Ang male condoms kasi is ipapasok siya sa penis or maliit siya kaysa sa female condoms. Kasi yung female condoms kasi is malaki siya na parang cellophane na i-insert dun sa vagina. So, dito papasok itong condom ng babae is dito po mapasok yung penis ng babae ng lalaki rather kapag hindi gagamit ng condom yung lalaki. So, female condoms create a barrier that prevents bodily fluids and semen from entering the vagina. So next, we have surgical methods. So this method ensures conception is inhibited permanently after the surgery. So there have two kinds of surgical methods. First, we have vasectomy. So what do we mean by vasectomy? A surgical operation wherein the tube that carries the sperm to a man's penis is cut. Cut it. It is a permanent male contraception. So ito yun sa male, no? Kapag hindi na gusto yung lalaki na makabuntis, no? So sa makikita natin sa picture, no, sa vasectomy, may pinuputol, no? Para hindi na, ito yung paraan para hindi na makabuntis yung lalaki, no? Para hindi na din magkaroon ng sperm na pwedeng matransfer sa babae or sa reproductive system ng babae kapag nag-intercourse sila. So, second is we have tubal ligation. Surgical procedure for female, no, sa babae naman. Fertilization involving serving and tying or ginahikot nila hikot the fallopian tube. So, sa makikita natin, no? Sa makikita natin sa libro, no? Pwede siya i-cut, pwede din siya itay or itali lang, no? Para maiwasan yung pagbubuntis din ng isang babae. So, that's the end of my report. So, I hope na may natutunan kayo sa aking report. No? So, by the way, I'm Christine Masili and have a good day.